All right, everyone, welcome to the 2022 Pinning Recognition and Awards Ceremony. My name is Jordan Langer, and I represent the University of Wisconsin Madison School of Nursing as the Alumni Relations Officer. It is my privilege and honor to work with Badger nurses every day through a variety of ways. As we begin our celebration this evening, I would like to share a brief land acknowledgement. We must remember and recognize that the land UW-Madison and the School of Nursing rest on is native Ho-Chunk land. There's a permanent marker atop Bascom Hill, recognizing our shared future to identify and acknowledge the circumstances that led to the forceful removal of the Ho-Chunk people. We must not forget these events in our history, and our greater university community will continue to honor their inherent sovereignty and the history of resistance and resilience. Thank you. I want to welcome our students who have been nominated and selected to receive a nursing pin. I want to thank our alumni and family members of our alumni who've been generous in gifting their nursing pins to the next generation of Badger nurses. Family and friends, thank you for being here to show your love and support for our soon-to-be graduates. Thank you to our incredible leader, Dean Linda Scott, for instilling the importance of tradition even during our ongoing global pandemic. Our virtual ceremony has allowed our out-of-town alumni, families, and friends to participate no matter where they are in this valuable experience. This is such an incredible moment in time, and I thank you all for taking the time to pay tribute to this tradition of passing alumni pins to our graduating nursing students. I would now like to introduce you all to our Nurses Alumni Organization President, Ashley Feelick, who will share a few words about the symbolic history of the nursing pin.
Thank you, Jordan. Good evening, everyone. Thank you for being present for this event. Like Jordan said, my name is Ashley Feelick, and I am currently a Doctor of Nursing Practice clinical nurse specialist student who is graduating this May. I graduated from UW-Madison with my undergraduate nursing degree in 2009. The School of Nursing pin symbolizes a proud tradition of service expressed through each of its parts. Given annually, the pin signifies both achievement and promise. Designed in 1926 by Helen Denny Schulte, the school's first director, the pin consists of the university's seal on a maroon cross with a caduceus. The cross patée dates from the Middle Ages when it was worn by the Knights Hospitaller, a nursing order. Its wings represent a bird covering its young, symbolizing protection and nursing. A caduceus, two snakes winding around a staff, symbolizes medicine. The Nurses Alumni Organization established the Pin Donation Program in 1997 and has been awarding graduating students with alumni pins ever since. The pin of the UW-Madison School of Nursing embodies a proud tradition of service. The passing of the pins to our new graduates is a sign of the recipient's achievement and promise. All UW-Madison School of Nursing students, faculty, and staff are invited to nominate graduating students to be considered for a pin. The strongest candidates are considered caring people. They are well-rounded in personal and service-oriented commitments and have recognized academic accomplishments. Students can be considered due to their perseverance in overcoming challenges to complete their nursing education. There were incredible nominations submitted on behalf of our students, and it was truly a difficult decision. In our opinion, as the NAO board, we believe all our students are worthy of a pin. Tonight, we will hear from our alumni pin donors, allowing our students the opportunity to meet the owner of the pin they are receiving and express their gratitude. I would first like to welcome Dean Linda Scott to share her thoughts on tradition and present the Dean's pin.
Thank you, Ashley, and good evening to all of you who are attending tonight. We thank you for being here with us. I would also like to welcome our Nurses Alumni Organization members and leaders. Thank you for organizing and supporting this event. I would also like to welcome members of our Board of Visitors who have joined us this evening, including our board chair, Nancy Fraser Mikowski. In addition, it is my pleasure to welcome our nursing pin donors or their family members. Thank you for contributing your nursing pins for this purpose. It is even more special that you have chosen to join us this evening. And of course, I would like to extend a welcome and congratulations to our soon-to-be graduates who have been selected as Pin recipients. I hope you are proud of being selected for this honor. Pins have been a tradition in nursing since the 1800s and are unique to each school. The pin you receive this evening should always be a reminder that you are connected to others and the school's history and our community. It should also reinforce that you are a part of a developing story of the School of Nursing. As we approach our centennial year, 2024, we will honor and highlight the nurse leaders from our past who have built the school's legacy. I hope that you will join us on our centennial celebration, where we will continue to strengthen the connections between generations of School of Nursing alumni and friends. All Badger nurses have important things in common. Pin recipients, just like you are now, the School of Nursing graduates before you were excited and even a bit daunted, but were very well prepared for what comes next. As new graduates, they used what they knew, continued to learn, and went on to change lives throughout their nursing careers as clinicians, administrators, educators, researchers, and entrepreneurs, among others. Tonight's Pin donors believe in you and believe in what you will do now that your time has come to continue the school's legacy. The gift of receiving a pin from one of our donors is a tangible reminder that you are not alone. You have the support of those who came before you. We believe in all of you. So with this in mind, I would like to award our first pin of the evening, the Dean's Pin. It is a pleasure for me to award the Dean's Pin to a truly outstanding graduate student, David Soul. David is graduating from our traditional BSN program, and he was nominated by a fellow School of Nursing classmate, Max Wiest. David exemplifies the traits of a nurse who will contribute greatly to the profession and society, and he already has. David paused his college education to serve for 4 years in the U.S. Army as a combat medic. He was deployed to Afghanistan from 2010 to 2011. During that time, he gained knowledge and experience providing care to fellow soldiers on the front lines of combat. After his service, David returned to his education to earn his degree, meeting the demands of the classroom while also raising 2 children and balancing 2 jobs to support his family. He was on the dean's list as he completed the prerequisite courses to prepare for enrollment in the nursing program. Yet, David's interest in using service and leadership to improve people and communities led him to enriching the lives of youth and aging populations through his personal time, mentorship, and involvement. David started an inclusive scouting group called the Navigators and was also involved in community service in ways that benefited local older adults until it was no longer possible due to the COVID-19 pandemic. David is described by his nominator, Max, as one of the most caring and thoughtful people I have ever met in the nursing program here at UW-Madison. Max also included in his nomination form that despite all that David balances in his own life, he makes time to support others who need it. He is always willing to help where he can. So David, your commitment to improving lives and health through your military service, the nursing profession, and as a leader in society is worthy of our recognition. It is a pleasure for me to award you the Dean's Pin. Congratulations, and I invite you to unmute your microphone and share a few words to our Pin donors and other guests about what this means to you. Congratulations, David.
Wow, thank you very much, Dean Scott and Max for nominating me. Thank you very much, Jordan, for coordinating all of this and the legacy that that exists at the UW and all the alumni. Thank you all very much. Thank you to my family and everybody. Geez, I feel like this is like an award ceremony or something. You gotta congratulate and thank everyone. This has definitely been long and a challenging endeavor, and I'm I'm very, very honored by this nomination, by this pinning. I recognize that I do stand on the shoulders of many giants before me. And so I really am honored by this. You know, so often we measure our success by GPA and other things like that. And I think, you know, moments like this really are pivotal and recognizing that, you know, one is on the right path. So thank you all very, very much. Thank you very much, Dean Scott. I am very honored by this. Thank you so much.
You're welcome. Thank you, David. I wish you the very best as you complete your baccalaureate degree and find the next opportunities for impact as a nurse. Please keep us informed along your journey. And now we'll hear again from Ashley, who will introduce our next speaker. So Ashley.
Thank you, Dean Scott, for sharing those inspiring words and presenting David with the Dean's Pin. And thank you as well to David for your remarks. Congratulations. I would like to next welcome the School of Nursing's Board of Visitors Chair, Nancy Fraser-Mahalski, to present the Board of Visitors Pin.
Good evening, everybody. The School of Nursing's Board of Visitors is a group of leaders from healthcare and business communities who provide both strategic guidance to the school. The pin is donated by the board. The pin recognizes a student's leadership and strategic guidance. It's our pleasure to introduce this year's Board of Visitors pin to recipient Ray Okoy. Ray was nominated by a fellow nursing peer, and here's a brief overview of the nomination. Ray is a dedicated student and mother. She has succeeded in navigating the very difficult task of nursing school, clinicals, and raising her young daughter. Ray has also overcome the challenges of immigrating to a new country and working to solidify her work visa to start her nursing career. No easy feat. Ray's significant accomplishment is her work with the Nigerian Mother Support Group. She provides support, education, input, organizing, and more to her group, which includes new moms, pregnant people, and other knowledgeable professionals. Ray is one of the most caring people I have met. She is a natural nurse who can make her patients, friends, and strangers feel comfortable and cared for in her presence. Ray, on behalf of the School of Nursing Board of Visitors, congratulations. You are so deserving of this recognition. We are so proud of you, and we now welcome you to say a few words.
Wow, thank you so much. This is indeed an honor. And yes, this is my ultimate patient, Carissa. Thank you so much for everything. I really, really appreciate it. Thank you, thank you, thank you. I'm just, for the first time, I'm actually short of words, but thank you. This is indeed beneath my wings. I know sometimes it's tough being a mom, going to school, juggling everything, but you know, in a place that is so supportive, like you know, the University of Wisconsin-Madison nursing program, everybody's willing to hear you out, willing to listen to you, ready to offer you help and care. So I find myself so privileged. Initially, this was far-fetched, but I feel so blessed and opportune to be able to make this program. So thank you. Thank you. I truly appreciate it. Thank you.
Ray, congratulations again. There's some great chats coming through here. So again, I encourage anyone to add some words of encouragement in the chat when you see fit. Now it's our time to celebrate and congratulate and honor our students who are receiving pins donated by our nursing alumni here with us tonight. So Ashley, myself, and other members of the Nurses Alumni Organization board will be announcing names of our student recipients and the alumnus pin they are receiving. So students, again, be willing and ready to share just a few words about what this moment means for you. And if you'd like to share what your plans are post-graduation, we'd love to hear those as well. I know our pin donors are excited to meet you and share a little bit of wisdom or advice as you journey on this next chapter. So again, I'll hand it back to Ashley, but congratulations to Ray and David.
All right. So Ashley Thomas will be graduating from the traditional BSN program in May, and she will be receiving Molly Myers Nursing Pin. Ashley is a first-generation student who has worked hard to obtain a dual degree while balancing work and extracurricular activities. She considered her acceptance into the traditional BSN program one of her greatest achievements. Her experience with the Spanish language and culture has helped her bridge cultural barriers to provide care. She has spoken with Wisconsin state senators regarding the inaccessibility of care for non-English speaking patients, and is now committed to improving matters at the patient family level. Ashley is receiving Molly Meyer's nursing pin. Molly is a 1971 graduate of the School of Nursing. We congratulate her for reaching her 50-year reunion milestone last fall. In December of 1971, Molly started work at Yale Health Plan, a new PPO HMO for Yale University. She became a certified adult nurse practitioner in 1973 through Yale School of Nursing. She worked as an advanced practice registered nurse for more than 45 years. Molly was also an assistant clinical professor at the Yale School of Nursing and was a preceptor for many years. She helped establish the Athletic Medicine Clinic and worked with Yale University athletes for more than 40 years. Molly, we would love to hear how your School of Nursing education has served you in your professional career and share any advice you have for Ashley.
I'm really honored to be presenting my pin to Ashley. I've had it sitting in my jewelry box. The pin meant a tremendous amount to me. My career at Wisconsin, I can never begin to express how it was. I went to Skidmore first and was a nursing student there for a while and finished up actually in history because I was having a little distresses. And I got into Madison, came from upstate New York to Madison, Wisconsin. I'd never been out there before, arrived during the Vietnam War. So I was a house fellow for a couple of years, but I can't tell you how much the career, my lifetime there and what I learned in Madison, I mean, it made it possible for me to become a nurse practitioner and to do, I also was an oncology nurse practitioner for 40 years at all outpatient, as well as doing the athletic medicine stuff. I've received lots of nice honors. I can't tell you how much Madison meant. So I'm a very loyal alum, and the friendships that I made there too, you know, the years of the friendships. And I can only say to Ashley and to all of you that you've got to be proud of what you're doing, and you have to be confident in your abilities, but also be humble and be willing to learn from everybody that you're hanging out with, and all the way from the housekeepers to the physicians. But also you have to learn to take care of yourselves, and that you need to remember that you have friends and family, and you need to not work 24 hours a day, which sometimes happens. And that there's a lot, I can't imagine not being a nurse and not being a nurse practitioner. I was very lucky to be in the first certified group and in the forefront of adult nurse practitioners. So thank you for letting me share my pin. I really appreciate it. Thank you, Jordan, for everything you do.
I was gonna say, I can kind of talk back. Well, hi, Molly. It's really nice to meet you. I'm Ashley. I'm really thankful to be receiving your pin, not only because you seem to be such a remarkable nurse, but also just to be part of this legacy, the Badger Nurse legacy, and to also be honored amongst my very excellent peers. So thank you very much for that. I love your word of advice, and I'm excited to start my nursing career this summer. I'm going to be at the Trauma Life Support Center at UW Health. And like you said, I am excited of working a job that I'll be proud of.
Thank you, Molly, for sharing, and congratulations, Ashley. I have the pleasure to announce our next Pin recipient. Raquel Burnham will be graduating from the traditional BSN program, and she is receiving Stephanie Swartz's pin. Raquel was nominated by Assistant Professor Mai-Chu Lor. In her nomination, it states Raquel has received several awards. She is a scholar of the Center of Educational Opportunity. Raquel was selected to be in the School of Nursing's honors program and received several scholarships, including the Charles A. Ekberg Foundation Scholarship, the Nina Sween Memorial Scholarship, and the K.M. Schau Scholarship in Nursing. Raquel embodies the principles of the Wisconsin idea. Her past and current volunteering experiences involve providing services to the community beyond the university campus. She volunteered as a Health Occupations and Professions Exploration Mentor, or HOPE, with the Boys and Girls Club of Dane County at UW Health. The purpose of the Hope Mentoring Program was to teach and involve high school students, particularly those who are first generation from Dane County, about the variety of professions in healthcare and to explore the pathways to achieve those professions. As a mentor, Raquel attended monthly meetings with her mentees, shared her college experiences, and helped her mentees explore different career options. Through this program, Raquel has mentored a total of 6 high school students. She has also held several leadership positions in the Multicultural Student Nursing Organization, or MSNO, for 3 years. For example, in the first year, she was the vice president, followed by being the president in the second year. Currently, she is the nursing school liaison. Her role as a liaison is to connect MSNO members to the School of Nursing and provide opportunities and aid to students to navigate the nursing program. In these positions, she meets bi-weekly with members. Raquel has made a significant impact not only in MSNO, but also among its members. Specifically, she created future goals for incoming members to achieve, provided a safe space for students to discuss, address potential prejudices they experienced, and mentored pre-nursing students. These volunteering experiences illustrate Raquel's mentorship and leadership in creating opportunities and an inclusive environment for minority and first-generation students on campus and beyond. Raquel will be receiving Stephanie Swartz's pin. Stephanie is a 1974 graduate of the School of Nursing. Stephanie began her career as a new graduate at the VA hospital in Minneapolis in critical care. She was the first new graduate nurse hired in critical care at the VA. Her love for skiing and nursing brought her to Vail, Colorado, where she worked at the Vail Valley Medical Center for 3 years. And of course, she skied every day. Stephanie was recruited to the University of Virginia, where she worked jointly in the emergency department and with the School of Nursing. She returned to La Crosse, Wisconsin, when one of her parents became ill. She then worked at Gunderson Health for 42 years in different administrative positions: chief nursing officer, hospital vice president, and the director of 4 different service lines: emergency services, critical care, neurosciences, and medical surgical. She retired in 2020. Congratulations. Stephanie chose to donate her pin to give back and return the favor for the excellent education she received at the University of Wisconsin School of Nursing. Stephanie, would you please share any reflections you have or words of wisdom for Raquel?
I am so honored to donate my pin to Raquel. It looks like she's already been in the same area of work that I started at UW-Madison, volunteering with Blue Bus and the clinic that was, a big part of my work in Madison back in the 70s. And my also passion is for inclusion and support for diversity. So I just think that intro is wonderful to hear about Raquel. And so I look forward to watching her progress in her career. And I've got a couple of recommendations I would make for new students. UW-Madison was the best springboard I could have had for my career. And I traveled a lot before there were travel organizations. And you just have to take risks and advance in the direction of your dreams. Be caring and compassionate. What you get done is dependent upon the relationships that you build, and really spend that time self-care, self-awareness, get to know good communication, conflict resolution skills, and work on emotional intelligence. And then give back yourself, be a mentor, and the whole cycle starts again. So congratulations, Raquel.
Thank you so much, Stephanie, and thank you to the School of Nursing. The opportunities that I've had at SON have been unparalleled to anything else. I have been involved in every aspect of that school, and I'm sure that faculty, I always like to joke, are probably sick of hearing my name or seeing my name in emails. But I'm just always involved, and I'm always trying to do exactly what you were saying, Stephanie. So thank you so much for your words, and I'm very grateful for your pin and for your beautiful words again. And I will be continuing my nursing career as a OR nurse resident at Northwestern in Chicago. So thank you so much.
Thank you, Raquel and Stephanie. It's my pleasure to announce that Nancy Yang will be receiving Mary Moat's nursing pin. Nancy will be graduating from the Bachelor of Science in Nursing program. She was nominated by Assistant Professor Dr. Mai-Chu Lohr. In her nomination, Dr. Lohr wrote that Nancy is a bright young woman who stands out from her nursing peers, specifically in the area of nursing research. Nancy has made a significant contribution to an innovative research project funded by the Nursing Institute of Research through the National Institute of Health. The project focuses on pain communication between Hmong patients with limited English proficiency, interpreters, and their providers. Specifically, the goals of the study are to revise and evaluate a pain information visualization communication tool and to test the tool in primary care settings. Dr. Lohr writes that Nancy works as a student research assistant at the School of Nursing. In this role, Nancy assisted in revising the pain InfoViz, transcribed interviews, organized documents, and presentations for the InfoViz interviews. Most importantly, Nancy's art skills have contributed significantly to the revision and finalized pain InfoViz that resulted in a culturally and linguistically appropriate planned communication tool for LEP Hmong populations. They are currently testing this tool in primary care settings. Dr. Lohr writes that Nancy is very productive. She's currently co-authoring 3 transcripts focusing on the revision and evaluation of the pain InfoViz tool, a systematic review and research among limited English proficiency populations, and the development and evaluation of pain phase severity tool for LEP Hmong population. I cannot think of an undergraduate, Dr. Lohr says, with this level of enthusiasm, dedication, motivation, productivity, and creativity. I cannot think of anyone more deserving than Nancy Yang to receive a nursing pin. She exemplifies the Wisconsin idea by conducting research with the Hmong community to co-create a pain communication tool and reducing health disparities for populations who have limited English proficiency and low health literacy. Dr. Lohr ends by saying, Nancy is a true leader. Congratulations, Nancy. Mary Moat, the person who gave you this pin, graduated from the School of Nursing in 1977. Mary worked as a staff nurse and head nurse at Methodist Hospital in Madison before earning her master's degree in 1982. She later served as the director of nursing, medical, surgical, and oncology at St. Joseph's Hospital in Milwaukee. Mary also practiced at several medical clinics in Milwaukee and at the Milwaukee VA for 20 years. Mary, what would you like to say to Nancy and the students that are here this evening? And then we'll have Nancy provide her comments.
I'm really thrilled to be able to pass on my pin. I was a diploma graduate originally from Methodist Hospital School of Nursing in Madison, but my education at UW Madison and the School of Nursing meant a lot to me and prepared me for many challenges that I had in the future. I was thrilled to learn that Nancy was involved with pain management. For the last 20 years at the VA, I was involved in setting up the palliative care program and worked a great deal in pain management. So I feel like passing on my pin is going to help me carry on some of that work and thought that I had. So Nancy, I wish you the best of luck. You're so prepared, much more than I was when I was a graduate. Puts me to shame when I hear of some of these biographies. But I had a real passion for nursing, and it sounds like you do as well. And that passion will carry you through. As I've heard other people say, do take care of yourself. But if you continue to have that passion and love for your profession, you'll never feel like you're working a day in your life. So congratulations, Nancy.
First and foremost, thank you. Mary, it's so nice to meet you. Thank you for your pin and your words of wisdom. You have such a great nursing history, and I can only hope to be as amazing as you were. I'm incredibly humbled and grateful for this recognition. And really, no matter how obvious or subtle, the help and guidance that I've received did not go unnoticed. I am truly lucky to attend a university that supports their students. And I will be continuing my career at UW Health's Clinical Research Center. So again, thank you so much.
Congratulations. And thank you, Mary.
So thank you for sharing, Nancy and Mary. I'm telling you, I'm going to be crying in a moment. The stories here are just so wonderful. And I concur with a few of the comments when I think about what these young people have already done. I just marvel at the successes that they will be having. I'm very pleased to be here this evening to announce our next PIN recipient and PIN donor, Shanaza Unwoza. She will be receiving the nursing pin donated by Eileen Smith. Shanaza was nominated by a faculty member, Dr. Jackson, who is really a leader in the accelerated BSN program. Dr. Jackson shared that Shanaza had experienced some challenges related to the demands of the program early on. But like any smart person, she knew she needed to reach out to overcome those obstacles by seeking guidance from faculty, clinical preceptors, and peers. This is a sign of a true leader who recognizes their weaknesses, what they need for help, and asks for it. And Shanaza had grown up and had a great passion for nursing. She actually was born and raised in Nigeria and began college at the age of 16. This is a very smart young woman. Unsure of what she wanted to do, she completed an undergraduate degree in biology and also has obtained a master's degree in business administration and management. She hopes to one day be a critical care and family nurse practitioner while pursuing opportunities to partner with NGOs in Nigeria to provide cardiac care to vulnerable populations. Shanaza is receiving Eileen Smith's nursing pin. Eileen graduated from our School of Nursing in 1969 and also went on to earn her master's in nursing from the University of Wisconsin, Madison in 1997. Eileen had a 37-year career as a distinguished nursing faculty member at Northern Michigan University in Marquette, Michigan. She received the Distinguished Faculty Award in 2010. Eileen and Shanaza, would you now care to share a few words with us?
Thank you, Linda. As you had said, I graduated in 1969, which was 53 years ago, and I just finished my last official nursing visit as a hospice nurse practitioner 2 months ago. So it's been a long but very enjoyable, rewarding career. And I have always been very proud and grateful to be a graduate of the University of Wisconsin because I think it provides a wonderful foundation for moving forth in life and having a wonderful career. I was trying to think of words of wisdom, and I always go back to just thinking about what a gift nursing is for us, has been for me, and has been for, I think, everybody that's listening, in that it really gives us so many choices as far as where and how we can practice the science and art of nursing. And my words of wisdom for you, Shanaza, are to remember that nursing, first and foremost, is a caring profession, and that we need to really listen to and respect the people and families that come into our presence. I think it gives us the honor and privilege of being able to be with people and help people at times when we really can make a difference. And so I guess those my thoughts is really continuing to think about the people that we are working with. I'm just so pleased that my University of Wisconsin nursing pin is going to continue to be a part of making a difference in the profession of nursing. And I'm incredibly impressed with your background. So thank you for being in the program and helping me be a part of this day today.
Thank you so much, Irene. I'm honored and extremely grateful to receive this pin from you today, and I'm glad to continue your legacy and your great work. I'm also proud to be a part of this prestigious organization. I know this is a big responsibility, and I'll continue to work harder to get to greater heights and to continue to uphold the profession of nursing. I'm extremely grateful to Dr. Jackson and my clinical instructors. I'm grateful to my parents and my guardians for investing in me. Thank you so much.
Thank you both for sharing your reflections and thoughts with us. And again, congratulations. Our next PIN recipient is Kaya Miller. Kaya is graduating from the traditional BSN program, and she was nominated by clinical instructor Jen Drake. Jen shared that Kaya is always engaged and committed to her learning. She is a bright student and has excellent insights to share. Her life experiences provide an alternative perspective, which has enhanced class discussions and increased the knowledge of her peers. She is a first-generation college student and has experienced many hardships in her young life. These steps on her path have driven her self-sufficiency and commitment to being a nurse, as well as reinforced her passion to be a voice for her community. Kaya is working with Dr. Okoy on an ambitious project to explore the impact of the threat of dying young among the young Black adult community. She grew up witnessing the impact of gun violence on her community, which has fueled her passion to improve the health of the Black community even more. She is most deserving of this recognition. Kaya will be receiving Jane Farrell's nursing pin. Jane graduated from the School of Nursing in 1961. Jane spent her career primarily in nursing education, staff development, teaching in nursing schools, developing several teaching projects for the UW Extension, teaching prenatal classes for expectant parents, and facilitating clinical testing for Excelsior College, which is in New York. Her final job before retiring was serving as the director of the Excelsior Clinical Performance and Nursing Center in Madison for 11 years. Jane, thank you for donating your pin to Kaya. We'd love to hear more about your nursing journey and what it means to have your nursing pin legacy continue with Kaya. So Jane, I invite you to unmute yourself, and then Kaya after.
I have loved my School of Nursing pin for over 60 years now. It's amazing to think it's been that long. I pinned it on with pride every day I was in uniform during the 50 plus years of my active nursing career. In the dozen or so years since I retired from the consulting job I did after leaving my full-time job directing a testing center, I thought about that pin periodically. I decided I wanted to pass it on to a UW graduate, just beginning her nursing career as I was when I was pinned on me so long ago. I simply could not let it languish in my jewelry box any longer. Kaya Miller will wear my pin. Kaya, I hope you will quickly find, as I did, that your nursing program here at the UW has provided you with the foundation for any kind of nursing you may wish to take up. I just made a quick list and found that I have practiced in at least 10 discretely different aspects of nursing. Sometimes I would study and figure it out as I went. Sometimes I'd attend a workshop. Sometimes I searched out a mentor when I was starting something different. And sometimes I needed to go back to school to prepare myself. Often it was a combination of several of these steps, but I was always building on the principles and foundation and the problem-solving skills that I learned at the UW. I actually never doubted that I would be successful because I knew how to get whatever I needed to do done. Total disclosure, I admit it did take me several years in the real world of nursing to fully appreciate the quality of education that I had received at the university. Kaya, my hope for you is that you will wear my pin with the same love, with the same love and pride that I did. Have a wonderful life in the exciting world of nursing.
First of all, thank you. So I'm wearing your pin now and I feel all the love and everything. And I really, really appreciate you. I know it was hard. And I really appreciate you giving it to me. I plan, sorry. It really means a lot to be honored like this and to be, sorry, I'm like rumbling my words now. Sorry. Yeah, so thank you so much. My plan after graduation is to continue being an advocate for my community and to continue educating as well. I am really interested in educating the community just as you were. And I right now will be working at Select Specialty Hospital as an RN. And then from then, I'm not really sure, but those are my next steps. Thank you so much again. And I will proudly wear your pin until I'm done with nursing. Thank you so much.
Thank you, Jane and Kaya. I am honored to share our next pin recipient. I'm sorry, I'm actually getting a little emotional myself. I'm honored to share that Micah Ho is our next pin recipient. I have been extremely lucky to work with Micah since she started the traditional BSN program, as she was hired as one of our students, our School of Nursing student ambassadors. She has been an outstanding representative and a perfect example of what a Badger nurse exemplifies. I could not be more excited to recognize her for this honor tonight. In terms of her experiences as a nursing student, Micah has advocated for patients during an interdisciplinary team meeting and made a significant note that altered a physician's assessment. She has changed the data entry systems for a research project to ensure data integrity, drafted guides and tools to support her coworkers and peers within the School of Nursing. She has consistently maintained a strong GPA during her education and made the Dean's List while obtaining a dual degree in both nursing and human development and family studies. Micah is also a member of the Sigma Nursing Honors Society. Micah, you will be receiving Nancy Dextrum's nursing pin. Nancy graduated from the School of Nursing in 1966. After graduation and marriage, Nancy and her husband served in the Peace Corps in the Dominican Republic. Upon returning to the States, Nancy worked as a staff nurse for the Visiting Nurse Service, the Veterans Administration, and a small community hospital in Wisconsin. Upon moving to Michigan in 1975, she started an administrative track, which exposed her to a multitude of new educational experiences, including as the Assistant Director of Nurses, a Patient Education Coordinator, the Associate Chief of Nursing Education, Director of Med-Surg Nursing, and eventually became the CEO of the Rogers City Rehabilitation Hospital. I'm so pleased to connect the both of you tonight, and I feel confident that Nancy's pin will continue to serve Micah well in her nursing career. Would you both care to share any thoughts or reflections with us this evening?
Am I coming across?
Yes, we can hear you loud and clear, Nancy.
Okay. Well, it's been fun to be a nurse for 42 years. And nothing has disappointed me. I think the value of nursing is we can do anything we want to do. And so, Micah, it's going to blow your mind as to what you're going to be doing in the next 20, 30, or 40 years, because we just have so many opportunities. And I do have 3 principles that have guided me through my leadership experience that I want to share with you. And the first one is, when I moved to Michigan, I had my first experience in really hiring nurses. And so the first principle is hire healthcare nurses for their attitudes. You can always teach them their needed skill sets. And I say that because one of the first lessons that I learned in the 70s, I was an assistant director of nurses and I was the champion for policy and procedure manuals and Joint Commission. And I had to it was my responsibility to hire all of the registered nurses. And upon a first interview with Carol, who was a candidate, she was experienced in OB, and I needed a med-surg nurse. And so I turned her down for the position. Well, she was nice enough to come back a year or two later, and I had a second interview with her, and I hired her right on the spot. At that point, I had transitioned from expecting people to have clinical skills to knowing that people had to have the right attitude. And so Carol turned out to be an amazing nurse in med-surg. She became a head nurse, and I remember her to this day because she was just a dynamo in our nursing unit. So my second recommendation also deals with leadership. And this is a phrase I've used over and over. Employees respect what their supervisor inspects. And so many times in our work world, we are passing on standards that accreditation teams are making us comply with, or we have quality measures that are set that we might not be reaching. But I have just found out that the optimal results were obtained in raising our quality measures when the supervisors were personally involved in evaluating and measuring expectations. And in my last position as the rehab administrator, I had an OT who was the department chair for rehab. And every month she improved all of the department's quality measures. I couldn't keep up with her. And so that just demonstrates when you're really nitty gritty in with your teams, you will see improvement. And it makes such a big difference. We just can't tell people what to do. We have to be immersed with their findings and giving them feedback. And my third one deals with, you mentioned that I was in the Peace Corps. Well, I was going to school in the 60s. And of course, I was President John F. Kennedy. He was my hero when I was going to school. And he had a phrase that was called leadership and learning are indispensable to each other. And I have taken that in my work world throughout the years. I've had to learn new specialties as I moved to different organizations. In my last position as the CEO of a small 25-bed rehab hospital, it was probably my greatest challenge. My predecessor had been OT, and she knew the therapy department backwards, but she didn't know nursing. I knew nursing, and I didn't know the other disciplines. So it became a challenge for me to learn specifically what goals are set in rehab. But anyway, my previous experiences, I had been responsible basically for med-surg nursing. I was not experienced in rehab, the rehab world. So I had to worry about Joint Commission, CARF, all of the hospital inspection standards. But the biggest challenge that I kept learning and learning and learning 2 years before I retired, I had a 2-person medical records department, and they both had babies and went on maternity leaves the same time. And I couldn't turn coding over to anyone in the organization. So I went through my Association of Rehab Administrators. I found a mentor, and she proctored me, and I got the coding done. And so here is the CEO doing coding during a maternity leave. But it was just a learning experience, and it just went with the flow of my whole lifelong learning. And nurses, as nurses, that is us. We are always learning. So I couldn't be more pleased. It's just been a terrific experience, and I've never regretted 1 minute.
All right, thank you so much. And first, Jordan, you got me tearing up a little bit. But thank you so much for this pin. It's truly such an honor. hearing the stories of the alumni and even just my peers of all the accomplishments, it makes me so proud to be soon to be joining this profession. And what your last point there, Ms. Dextrum, about your coding experience just makes me think about nursing in general and how we have to learn how to be flexible. And COVID has certainly showed us that. But thank you so much. And after graduation, I will be holding 2 roles as a nurse. I'll be working in the emergency department at UW Health for my residency. And then I will also be working as a research coordinator for a study that is through the School of Nursing, aiming to improve mobility in older adults. So similar to Ms. Dextrum, I'll be holding multiple roles, but I hope to accomplish as much as she has during her nursing career. So thank you.
Thank you, Nancy and Micah. I am honored to share our final pair for the evening. Max Weiss will be receiving Katherine Ekberg's nursing pin. Max is a member of the Sigma Honor Society in the Beta Eta at-large chapter. He has maintained a strong GPA throughout his nursing education. Max manages several commitments outside of academics, including working part-time while also performing duties for the Army Reserves. This includes extra training, promotion preparation, teaching soldiers, and monthly drill attendance. He competed in the U.S. Army Best Warrior competition and has mentored other competitors involved. This entailed physical training, mental preparation, and missing days to weeks of class time for training peers. Max is currently taking part in a research study related to the health of dementia care workers. Through this project, he conducts research and provides information to dementia caregivers to help them administer care efficiently while easing their workload. Max is well respected amongst his peers and instructors. I am pleased to share he will be receiving Katherine Ekberg's nursing pin. Katherine is also celebrating her 50-year milestone from graduation. She graduated from the UW School of Nursing in 1971, and upon graduation, she immediately entered the master's program in maternal child nursing at the University of Colorado. She went on to become the head nurse of outpatient pediatric clinics at the University of Iowa before entering the pediatric nurse practitioner program at UCLA. During her postgraduate nursing education, she supported herself working as a staff nurse or a private duty nurse. Following completion of her NP program, she was a commissioned officer in the National Health Service Corps for 3 years, working in 3 different healthcare manpower shortage areas, sometimes as the only on-site provider. When she returned to Wisconsin sometime later, she worked in college health, rural family practices, and a migrant clinic. We are so honored to have Katherine and Max with us this evening. Would you two like to share a few thoughts and reflections with us all?
I'm very pleased to be here and very honored to be in the company of so many alumni and accomplished students. 50 years ago, I gave the student speech at our pinning ceremony. So this is really quite fun to see. It's changed, as everything in nursing has. It has broadened, it's more inclusive, it's more collaborative, it's more integrative. And all of this has been wonderful for the populations we served and our professions and the choices that we can make. All the alumni have had wonderful suggestions about what you can learn, but this is really the beginning to a broad experience. I would suggest that everyone explore, challenge yourself, learn from anyone that you can. If you need help, ask for it. If you don't know, say so. You can learn so much and give so much. And I think nursing has expanded in its possibilities. Now we see such a shortage and nurses in so many roles that you've been given a wonderful foundation for that. So go forward. I'm very pleased too to see Max receiving my pin. Because he has done some of the military service. I was not in combat areas, but it was wonderful to serve our country in the public health service. And I learned so much about different cultures, different people. And that's something that nursing has a great deal to give to our population at large.
Thank you so much, Katherine. And thank you to all the alumni here. I definitely have some really big shoes to fill. Jordan's told me a lot about you as well. And I'm very grateful for this, and thank you very much. I'm looking forward to moving on with my career as an RN as I move beyond the LPN scope of practice in the trauma and surgical IMC at UW Health. And I just want to say thank you very much. I'm very honored.
You're very welcome. I'm happy. I'm very happy to be passing on my pin. It's a very nice symbol of a very good school.
Thank you, Katherine, and congratulations, Max. I also would like to say thank you to everyone for sharing your reflections, moments of gratitude, and memories with us this evening. This is one of those occasions where we all are witness to the Wisconsin idea in action. Our graduates are about to embark on their nursing careers while carrying the legacies of the pins they now have. And with that, I'll turn it over to Jordan.
Well, thank you, Ashley. I just want to again thank everyone for being here this evening, and we wish our 2022 graduates all the best as they carry and celebrate this important milestone with them. Students, you'll all be part of the Badger Nurse Alumni family very soon, and I'm excited to welcome you all to that family. So just remember, you are a Badger nurse for life, and the School of Nursing and the Nurses Alumni Organization is here for you after you graduate. So cheers to you and to this next step in your nursing journey and your lives. So as always, on Wisconsin, and thank you for being here.